Hi everyone, I'm here today with Cyril, aka Balu. Funny thing is he's a big baller. He likes to play basketball. So I've been working with him for a while, and in the beginning, and he'll tell you, you'd play every so often, and you always have these episodes of low back pain, where after each game, it was like the next day you're kind of out of commission, right? So how long was that like recovery period? It'd take you a few hours. You do a lot of like Epsom salt, stretching, and still sort of the same issue, right? And then you played that one-on-one, and that's when you hit me up, asked me about therapy.
Yeah, I was having a lot of lower back pain for a while, and there was a specific incident where I wasn't playing basketball for a couple days. I went ahead and played without really stretching. Immediately hurt my back, and I was pretty much out of commission for like 2-3 weeks with severe, like it would be difficult to get up and it would be difficult to lay back down. So I tried to like either just stay laying or stay standing for a long time, just because the transition would really feel like damaging my back while I was going through it. So I called Bhakti. I had her adjust me and teach me how to strengthen my lower back. And now...
So we did a lot. We did acupuncture. We did active release. I gave you some core stability exercises. We did some stretching, and a lot of that you were doing on your own at home too,
Right.
And then following up with me here and there. So it's been a few weeks, and you're doing great. So today
It's like night and day.
Yeah. So good. Today I'm going to focus on his neck, but I'm going to check his low back and his hips, because you said there is still a little bit of restriction, right?
Yes.
Okay. So I'm going to have you lie on your back, face up.
On my feet.
You can straighten out your feet.
Okay.
Just going to check your range of motion again. And it's usually your left side and your low back, right?
Right.
Okay. Left, right? So I remember when I would press down on this side, you would feel it on the opposite side in the very beginning.
Right. And now I don't feel it in that left side
Okay.
as much,
Okay.
or really at all.
Okay, good. That's because when I press down here, it's putting that the head of your femur into the hip, and so it's going to strain that SI joint and your pelvis. The SI joint is part of that pelvis, so it's like a ring, right?
Mm-hmm.
So sometimes if you put pressure and it's not moving, you'll feel it on the other side.
Mm. Yeah, I feel it more on this side now.
Okay, good. No pain there, right?
Nope.
Okay. Feels a little tighter on this side.
Yeah, I feel it a little bit.
In your low back?
Yeah.
Okay.
Not so much with that.
Okay. So this is a good stretch you can do. And I think I showed you this in the very beginning.
Mm-hmm.
So for you to stretch it on your own, sometimes it's a little bit hard with the socks because your feet will slide on the table, but you can do this in your bed or on the floor. You're going to use the weight of this leg to kind of pin down that femur.
Mm-hmm.
Keep your back on the table and just try to stretch. This is going to stretch more the front and side part of your hip. Good, so you'll feel a little bit in the TFL, a little bit in the glute. And just try to push as far as you can. Good, and hold for about 3 seconds. I usually tell my patients to pulsate through their stretches. Good. And then to stretch that same side, put that leg on top again, and again go towards me. rotate all the way. So, yep. This one you'll feel a little bit deeper, more into the piriformis and the glute in the back.
I feel it there.
Okay. Same thing, good. This one's nice too because you'll feel a little bit in your core. Let me see you do that on this side, just for comparison. Go that way.
I feel like I can go way further.
Right. Okay. So there is a little bit of restriction in your QL. Okay. Go ahead and turn on your side and face me. Do you do like side planks? I think
Initially,
okay.
I was. I'll do some core workouts like sit-ups and stuff like that.
Okay.
Just holding them plank, I haven't done recently.
Okay. Didn't I ask you to do some side planks when I last saw you?
Mhm.
Okay. But like if you were to do like Russian twist or medicine ball, do you feel anything on one side compared to the other?
Like it depends, like at the gym, how deep that incline is.
Okay.
If it's super deep, then I'm gonna struggle with the lower back a little bit more.
Okay.
But if it's like a light incline, I can kind of get through it without feeling too much pain.
Tender along here?
And it's like tender, like right up here.
Okay.
But this area feels not so bad.
Okay.
That's where it feels tender.
When was the last time you played basketball?
Like 2 days ago.
Okay. How was that?
Pretty good. It's good, a lot better than it's been getting better.
Okay.
So.
And what are you doing at the gym? What do you usually do?
I think I focus on my back the most.
Really?
Yeah.
Just because you like to, or you feel like it's still weak?
I just feel like I gotta maintain it.
Okay.
So that it doesn't like. I feel like if I skip my back,
yeah,
the longer I wait, the higher the pain is.
Okay.
And the more likely I'm gonna like hurt it again.
Okay.
But if I keep it strengthened, I feel like it levels out to like a normal place.
Okay. Feel it in here?
Definitely.
So is this?
Just using a little bit of active release, and again I'm moving the leg myself so it's not as painful.
Yeah, definitely helps. It's going deep though.
Yeah.
Ooh, right there.
So I'm just releasing the quad. shortening it, pinning it, and then I'm lengthening it, and that one I felt it roll right under my elbow. Again, I'm trying to use that flat part because I know I'm a little bit bony.
This is wild.
Feel that?
Oh, definitely. It's intense.
Now I'm getting the upper part of the quad, so remember the quad is going to insert down here past the kneecap, but it's going to start all the way up here right at this bony part. And then your psoas, that's just your quad. Your psoas is going to cross that joint and go into your belly. That's why in the past I've been working up in here.
Yeah. Yeah, you wouldn't really think it goes that far.
Yeah. Psoas goes to your hip, but it starts actually at the very front of your lumbar spine, attaches to all of those, and then goes down this way. So sometimes when you're doing like abs or crunches, you're actually using that muscle a lot more than you are your abs.
Yeah, makes sense.
So that's why people with like back pain or herniated disc, they really shouldn't be doing crunches and abs, sit-ups, things like that.
It's good with the planks though, right?
Yeah, planks are fine because you're straight, yeah. Is this tender or it just feels tight?
Just tight.
Okay. I'm gonna hold you here.
Mm-hmm.
I want you to take that top leg, straighten out the knee, and just kick your leg back slowly.
Like towards you?
Mm-hmm. Good. And come back. Okay, good. And go backwards.
Still keep it straight, right?
Mm-hmm. And then breathe out, hug tight. Good, relax, look down.
Oh. That was good.
Sit on your side and face me.
Hear that? Felt good.
Let me have you go on your stomach. Want me to take your glasses?
Yeah. I'm blind.
Relax your arms. Feels good?
Yep. Well, the chair, the table.
It's a soft table, right?
Mm-hmm. Usually you can't like lay straight flat on your face like this.
Yeah. It's hard to tell, but he's turning red.
Hmm?
No, I'm saying it's hard to tell, but you're getting that redness from the Graston. I feel like a knot right here.
Yeah, I feel like that's true.
So I'm just checking for motion, like these joints down here. There's a nice little give, there's like a little bounce. And then right here it gets a little stiff. And then up here, you feel like how it's not bouncy?
Yeah.
So it's usually joint, what we call joint restriction. Lift your, like bend your knees.
Both of them?
Yeah. And drop them. Lift your head up. Relax. And then this side, lift your head up.
Yikes.
Good.
Alright.
Alright, come on up.
Feel like a new man.